Good afternoon. Thank you for joining the Get the Fact webinar series. This is our first 2022 webinar. And this year, we will revisit functional food that have been used to help manage diabetes. We had a webinar series on diabetes in, I think, 2017. So at the time, we used the WebEx platform, not the Zoom. So unfortunately, we don't have access to the recorded file at that time. So we're going to revisit some of them, and then I'll also include updated information. So today, we will just talk about diabetes in general. I will talk about what's diabetes, what's happening in the body when someone has diabetes, and different types of diabetes, and the prevalence in this country, common symptoms, risk factors, complications, and how do we screen for diabetes, and also how can we reduce the burden of diabetes. Recorded webinar will be shared by Google Drive in 24 hours, and you can find it in 2022 under Get the Fact webinar recordings folder. And also, after professional captioning, the recorded webinars will be uploaded under the webinar tab under Food Health BCE website. I don't know how long does it take to request the professional captioning. I have one more thing to announce. As a training purpose, Prevention and Management of Chronic Disease Plan offers a chronic disease competence test. These are the topics we covered in the webinar series last few years. So currently, heart disease and diabetes and breast cancer, colorectal cancer, lung cancer, and Alzheimer's disease competence tests are available. So any agent who wants to build your capacity to adapt and implement information about chronic disease in practices may email me to this address. And once I get which competence test that you want to take, and I will send out the Canvas invitation and access code to each test link on Canvas. In that link, you can find the webinar video, and this video includes disease facts, symptoms, risk factors, pathology, screening method, and treatment method. After you watch those videos, you can take a test anytime when you're ready, and each test has about 15 to 25 questions. And to pass each test, you have to score minimum 80%. You can take the test as many times you want until you get 80%. And once you pass the test, you will receive your certificate by email. And you can buy into Prevention and Management of Chronic Disease Plan when you take the competence test and also the Get the Fact webinar series. So please let me know if you have questions regarding this test. Okay. So let's talk about diabetes. The full name of diabetes is diabetes mellitus. This term was derived from the Greek word diabetes, meaning to pass through, and the Latin word, the mellitus, meaning honeyed or sweet. So this is because excess glucose, also we call it sugar, is found in the blood as well as in the urine. So the World Health Organization defined diabetes as a chronic disease that occurs either when the pancreas does not produce enough insulin, or when the body cannot effectively use the insulin it produces. And insulin is a hormone that released from the pancreas and then regulates blood sugar. And we're going to come back to the pancreatic function later. And hyperglycemia refers to a condition that high glucose, also called the sugar level in the blood. And hypoglycemia is a common effect of uncontrolled diabetes. And over time, leads to very serious damage to many of the body's systems, especially nerves and blood vessel. And I'll talk about more on these complications later. So let's talk about normal glucose metabolism first. So human body needs energy for the normal functioning of the organs, and we are getting energy from food sources. Macronutrient in foods such as carbohydrate and protein and fat, those are the energy sources. Certain portions of fat and protein and most of the carbohydrates are converted to glucose. And then it would be entered and circulated in the blood system. The blood glucose is main source of energy for the cells in many tissues, including muscles and in brain and many other tissues. Our body has very efficient ways to regulate blood glucose concentration in a certain range, such as excess amount of blood glucose is converted to glycogen, excuse me, and then stored in the liver or muscle. And this process is called glycogenesis. And excess amount of glucose is also can be converted to fat and stored in fat tissue. This process is called the lipogenesis. If blood glucose level is too low, stored glycogen is converted to glucose and then released to the blood system and then delivered to the tissue and used for energy. And that process is called the glycolysis. So the healthy individual, these functions are pretty effective. In glucose metabolism, insulin plays a major role. As mentioned, the digestive tract breaks down carbohydrate into glucose, and glucose enters the bloodstream. And with the help of insulin, cells throughout the body can absorb glucose and then use it for energy. So insulin is a hormone made in the pancreas, which is organ located behind the stomach. In healthy individuals, after eating, the pancreas releases insulin into the bloodstream. And then insulin circulates in the system and enabling glucose to enter the cell. And that's how insulin lowers the amount of glucose in the bloodstream. As the blood glucose level drops, and the secretion of insulin from the pancreas drops. There are other pancreatic enzymes that work together with insulin. Pancreas contains clusters of cells called islets. 3 types of islet cells are scattered in the pancreas, provide hormones interbalanced in the regulation of blood glucose level. So alpha cell, you can see as a little gray dots. They are arranged around the outer rim of the islet, about 30% of the total islet cells, and that makes glucagon, which is the enzyme. And then beta cell, which is the composing most of the islet cells, about 60%. And then these beta cells make insulin. And delta cells, showing as reddish dots, they are spread between alpha and beta cells. So about 10% of islet cells, and makes the enzyme called the somatostatin. So when blood glucose levels rise after a meal, and beta cells in the pancreas release the insulin into the bloodstream to maintain glucose balance. We call that the glucose homeostasis. And glucagon released from the alpha cells counteracts insulin to keep blood glucose concentration normal. And then somatostatin released from the delta cells act in balance with insulin and also glucagon. So they keep all these enzymes, they keep blood glucose concentration in normal range. and try to maintain that range throughout the day. Now you can tell diabetes is a group of physiological dysfunctions characterized by high blood glucose due to abnormal glucose metabolism. So it's a metabolic disorder resulting from less or no insulin affecting glucose metabolism. As mentioned, glucose comes from two major sources, one from food, diet, and also from the stored form, which is glycogen. And controlling blood glucose level within its normal range, which is 70 to 120 milligram per deciliter, is vital to normal overall energy metabolism and other metabolic functions. I said insulin helps blood glucose to enter the cells. Let me briefly explain how that works. Circulating insulin binds to the insulin receptor. Insulin receptors are located on the surface of insulin sensitive cells, including those in the fat tissue or muscle tissue or liver cell and immune cells and etc. And once insulin binds to its receptor, it starts many activation cascade, including glucose transporter activation and translocation to the cell surface area. And then let glucose comes in to the cell from the bloodstream. So many research studies have shown that fewer number of insulin receptors in obese individual with diabetes, and weight loss in obese individual and physical exercise increase the number of insulin receptors. People with normal insulin sensitivity require normal level of insulin to process the glucose, whereas individuals with diabetes may not produce enough insulin to meet their needs. So glucose remains in the bloodstream, causing the high blood sugar level. In some cases, the person may actually produce more insulin than required. In that case, the pancreas is working overtime to produce more insulin because the cells are not sensitive to insulin. And despite the presence of plenty of insulin in the bloodstream, insulin cannot bind to the insulin receptor and cannot help uptake enough glucose from the blood into the cells. This condition is called insulin resistance. People with insulin resistance need a lot of insulin to process glucose, and this leads to multiple health problems. If an individual has any three of these conditions, that person may have insulin resistance. Waist size is over the 40 inches for men and then 35 inches for women. And triglyceride level in the blood is over 150 milligram deciliter. The normal range is less than 150 milligram per deciliter. And then the HDL cholesterol level, which is a good cholesterol, if that level is lower than 40 milligram per deciliter for men and then lower than the 50 milligram per deciliter for women, and by the way, normal range is above 60 milligram per deciliter, and blood pressure is higher than 130 over 85 millimeter mercury, the normal range is 120 over 80. And then fasting blood glucose level is higher than 100 milligram per deciliter. Again, if someone has any three of these conditions, it's possible to have insulin resistance. There are different types of diabetes: type 1, type 2, and gestational diabetes, and also pre-diabetes condition. So let's look into each type. Type 1 diabetes is thought to be caused by an autoimmune reaction, meaning that the own body attacks itself. So in this case, an autoimmune reaction stops the body from making insulin. Therefore, people with type 1 diabetes make little or no insulin. In consequence, glucose in the blood cannot be uptaken into cells. It often develops very quickly, and type 1 diabetes can occur at any age, but it's most often diagnosed in children, teens, and young adults. In people with the type 2 diabetes, insulin production from the pancreas is reduced, often accompanied with insulin resistance. Therefore, the body cannot keep a blood sugar level at the normal range. About 90 to 95% of people with the diabetes have a type 2. It develops over many years and is usually diagnosed in adult, but more and more in children and teens and young adults are diagnosed with the type 2 diabetes. Gestational diabetes developed at any time during pregnancy in a woman who does not have diabetes prior to the pregnancy. During pregnancy, many hormones like growth factor or progesterone and cortisol or prolactin, and these hormones are produced by the uterus to help the baby grow and develop. And some of these hormones can reduce mother's insulin sensitivity, leading to insulin resistance. So every year, 2 to 10% of pregnancies in the United States are affected by gestational diabetes. Gestational diabetes usually disappear after baby is born, but increases both mothers and babies' risk for type 2 diabetes later in the life. Prediabetes is a stage that blood sugar level is higher than normal, but not yet high enough to be type 2 diabetes. About 88 million American adults, more than 1 in 3, have prediabetes. And this is the CDC, the Center for Disease Control, link offering the prediabetes risk test. I think it has 5 to 6 questions to get an idea if the possible diabetic condition. So without lifestyle changes, people with prediabetes are very likely to progress to type 2 diabetes. Okay, let's look at the prevalence in the US. According to the CDC, in 2021 data, 34.2 million Americans, which is about 1 in 10 people, have diabetes. Of the people diagnosed with the diabetes, 210,000 are children and adolescents and younger than age 20 years, including 187,000 with a type 1 diabetes, and an additional 88 million in pre-diabetic state. Of those with the pre-diabetes, more than 84%, they don't know they have it. And diabetes is the 7th leading cause of deaths in this country. And a risk of early death for people with the diabetes is about 60% higher than for people without diabetes when it's compared to those people. And total medical cost and loss to work for people with the diagnosed diabetes is about $327 billion per year, which is twice higher than those costs for people without diabetes. This graph from CDC shows the trend of a prevalence among adult age 18 years or older in this country from 1999 up to 2016. So as you can see, by the way, diabetes prevalence is the total number of existing cases, including new cases. So prevalence of a total and diagnosed diabetes among US adults steadily increased from 1999 to 2016. For Virginia, approximately 700,793 people, or about 10% of the adult population in Virginia, have diagnosed diabetes. And additional 189,000 people have diabetes but don't know it. And over 2 million Virginians, which is about 33% of adult population, have prediabetes. It's estimated that every year, 59,557 people in Virginia are diagnosed with diabetes, and estimated diagnosed diabetes cost is about $8.4 billion each year. Let's look into diabetic symptoms. All these symptoms of diabetes, especially type 2 diabetes, can be very subtle and seem like harmless. Some people may not even have symptoms at all. And however, over time, they may develop diabetes complications. Diabetes symptoms vary depending on blood sugar level and insulin production capability, including excessive thirst and increased urination and fatigue and sudden weight loss and blurry vision. And when they got injured or cut, slow healing process and more frequent infections, and no more tingling hands and feet, and reddish, swollen, and tender gums. And those are the common symptoms. In addition to these symptoms, people with type 1 diabetes may also have nausea, vomiting, or stomach pains. There are some associated risk factors for each type of diabetes. Although the exact cause of type 1 diabetes is unknown. Factors that may increase the risk include the family history, and if a parent or sibling has a type 1 diabetes, and that person's risk can be increased, and exposure to a viral illness play some role in likely play some impact on type 1 diabetes. Certain genetic condition, such as the presence of damaging immune system or immune cells, called the autoantibody, that may increase risk of developing type 1 diabetes, but not everyone who has these autoantibodies develop diabetes. Certain countries, such as Finland and Sweden, have higher rates of type 1 diabetes. We don't know the reason. And risk factors for type 2 diabetes include prediabetes and overweight or obesity. The more body fat you have, the more resistant your cell become to insulin. And inactivity, which is physical activity, helps control body weight, and that can help to use up glucose as energy and make cells more sensitive to insulin. And family history and then race. Let me show the next slide first. So this slide shows the percentage of adults with diabetes by racial and ethnic group in the US between 2017 and 2018. Although it's unclear why, it appears that the percentage of the adults living with the diagnosed diabetes varied significantly by racial and ethnic group. So as you can see, 14.7% of them are American Indians and Alaskan Natives, and 12.5% is Hispanic, and 11.7% of non-Hispanic Blacks, and 9.2% of Asian Americans, and then 7.5% of non-Hispanic whites. However, no genetic predisposition has been known so far. Continuing to the risk factors for type 2 diabetes and age, as we get older, our risk increases. And this may be because we tend to exercise less and lose muscle mass and gain weight. But type 2 diabetes is also increasing dramatically among children, adolescents, and younger adults. And gestational diabetes and high cholesterol level or high blood pressure level that also associated with increased risk of type 2 diabetes. Risk factors for gestational diabetes include family or personal history, and then prediabetes, and then gestational diabetes during a previous pregnancy could increase risk. Being overweight before pregnancy increased the risk, and women who are Black, Hispanic, and American Indian or Asian are more likely to develop gestational diabetes. And again, we don't know the reason yet. Long-term complications of diabetes developed gradually. The longer you have diabetes and the less control the blood sugar level, and the higher the risk of complications. Diabetes complications can be disabling or life-threatening. Possible complications include cardiovascular disease, such as heart attack, stroke, high blood pressure, or high cholesterol. And with diabetes, over time, high blood sugar level can damage blood vessel and then nerves that control the heart. And kidney damage, called the diabetic nephropathy. Each kidney is made up of millions of tiny filters called the nephron. Over time, high blood sugar level can damage blood vessel and the kidneys as well as those filters. When the blood vessel and the kidneys are injured, the kidneys cannot filter and clean blood properly. Then the body will retain more water and salt, which can result in weight gain and swelling. And many people with diabetes also develop high blood pressure, which can damage kidneys too. And diabetes also may cause damage to the nerves in the body. This can cause a difficulty in emptying bladder. So the pressure resulting from full bladder can injure the kidney. And also if urine remains in the bladder for a long time, it can increase infection from the rapid growth of bacteria in urine that has a high sugar level. So over time, the dysfunctional kidney may release protein in the urine. Also, waste material will build up in the blood. Then kidney dialysis may be required. So about 30 to 40% of patients eventually will suffer from kidney failure. Another complication is a nerve damage called the diabetic neuropathy. Diabetes can cause damage to the nerves throughout the body when blood glucose and blood pressure are too high. Among the most commonly affected areas are the extremities, in particular the feet. So nerve damage in those areas can lead to pain, tingling, and loss of feelings. And loss of feeling is particularly critical because it can allow injuries to go unnoticed, leading to serious infections and possible amputations. Most people with diabetes will develop some form of eye disease called the diabetic retinopathy, causing reduced vision or blindness. Consistently high level of blood glucose level, together with high blood pressure and high cholesterol level, are the main cause of retinopathy. In women with any type of diabetes during pregnancy, risk a number of complications if they do not carefully monitor and manage their conditions. Pregnancy complications include organ damage to the fetus, and also high blood sugar can lead to fetus putting on excess weight, which can lead to problems in delivery, trauma to the baby and mother, and a sudden drop in blood glucose for a child right after the birth. And babies who are exposed to a long time to high blood sugar level in the womb are at the higher risk of developing diabetes in the future. And many other health problems, including oral health and hearing loss and mental health. For COVID-related complications, people with diabetes can be more severely affected by common infection, including COVID-19. The infection causes a stress response in the body by increasing certain stress hormones such as cortisol and adrenaline. These hormones work against the action of insulin, resulting in increased blood sugar level. Currently, it's been reported that people of any age with any type of diabetes, like type 1, type 2, and gestational diabetes, are at increased risk of a severe illness from COVID-19. Observations also suggest that patients with diabetes and COVID-19 may experience changes in their blood sugars and medication requirement. And they recommend to measure their blood sugar level more frequently. So they said it could get benefit for those people. So far, there are not enough data to show whether people with diabetes are more likely to get COVID-19 than the general population. And then there's no evidence to show that COVID-19 would contribute to the onset of diabetes. So CDC is continuously updating their website as new information about COVID-19 becomes, whenever it becomes available. Diabetes is a serious chronic condition. However, we can reduce the burden of diabetes and then prevent the progression of diabetes. Diabetes care has changed significantly with the new medicines, new devices, and better technologies emerging practically every year. Currently, there are several easy and accurate diagnostic tools, and there are various medical treatment methods depending on severity of the condition. For type 2 diabetes diagnosis, Glycated Hemoglobin A1c Test, we usually call the Hemoglobin A1c Test, and random or the fasting blood glucose test, and oral glucose tolerance test. Let's talk about one by one. So glycated hemoglobin test, the A1c test, measures the percentage of blood glucose attached to the hemoglobin. Hemoglobin is the oxygen-carrying protein in the red blood cell. In the bloodstream, glucose binds to hemoglobin, and then the bounded form is called glycated hemoglobin. Once glucose is bound to hemoglobin, it stays in bound form while red blood cells are alive. Normal red blood cells live about 120 days. So this blood test indicates the average blood glucose level for past 3 to 4 months period of time. The higher blood glucose level, the more hemoglobin are bound to the glucose. So an A1c level of 6.5% or higher, that indicates diabetes. And if that level is between 0.7 to 6.4%, that indicates prediabetes. If it's below 5.7%, that's considered normal. The advantages of this test are that it does not require fasting or drinking anything. And the A1c test is considered as an accurate method to measure glucose level, the long-term glucose level. However, if the A1c level test results are not consistent, if the test is not available, or if someone has a certain health condition that can make the A1c level inaccurate, such as a pregnancy or uncommon form of hemoglobin, and doctors may use other tests to diagnose diabetes instead of an A1c level. For random blood sugar level test, the tiny amount of blood sample will be taken at a random time. Regardless of when you last ate, the random blood sugar level of 200 milligram per deciliter or higher indicates diabetes. For fasting blood glucose level test, the blood sample will be taken after an overnight fasting. Fasting blood glucose level less than 100 milligram per deciliter is normal. Between 100 to the 125 milligram per deciliter is considered prediabetes. If it's higher than 126 milligram per deciliter, that's considered diabetes. For oral glucose tolerance test, after overnight fasting, the fasting blood glucose level is measured. Then you drink a sugary liquid, and the blood sugar level is measured after 2 hours after drinking that liquid. A blood sugar level less than 140 milligram per deciliter after 2 hours is normal. If it's between 140 to 199 milligram per deciliter, that's a pre-diabetic state. And then if it's higher than 200 milligram per deciliter, that's considered as a diabetes. If type 1 diabetes is suspected, in addition to the test I just mentioned, urine test can be used to look for if there are ketones. The ketones are the byproduct from the fat breakdown, the product of fat. And also, autoantibody test can be used to see if an individual has a destructive immune system cells associated with the, type 1 diabetes. For gestational diabetes, risk factors for gestational diabetes will be evaluated early in pregnancy. If a pregnant woman at high risk of gestational diabetes, for example, if she was obese at the start of a pregnancy, or had a gestational diabetes during the previous pregnancy, or she has a mother or father or sibling or a child with a diabetes, in that case, doctor will ask to the test the screening, using those test methods at first prenatal visit. If that woman at the average risk and gestational diabetes, she will likely have a screening test sometime during second trimester, which is typically between 24 to 28 weeks of pregnancy. So After diagnosis, continuous and regular management and treatment are required to control diabetic condition, including regular doctor's visit, blood glucose monitoring, medication, and surgery. So first, monitoring. So treatment of diabetes primarily involve monitoring blood sugar level along with diabetes medication, insulin, and or the oral medication. It's recommended to regularly visit your doctor at least every 3 to 4 months to discuss diabetic management. During these visits, the doctor will check A1c level, hemoglobin A1c levels. If your A1c level is increased compared to previous measurement, which is 3 months ago or 4 months ago, and your healthcare team may change medication strategy or meal plan. And frequent monitoring of blood sugar level is first step of management to many diabetic patients. Depending on treatment plan, an individual may check and record blood sugar level as often as several times a week to as many as 4 to 8 times a day. So careful and consistent monitoring is the only way to manage blood glucose level within the targeted range. Next treatment method is insulin. Sometimes they call it insulin therapy. People with type 1 diabetes need insulin therapy to survive because their pancreas no longer make insulin. People with type 2 diabetes and gestational diabetes may also need the insulin therapy as part of their treatment plan. Many types of insulin are available, including rapid, intermediate, and long-acting insulin option. So rapid-acting insulin works within 30 minutes after injection and stays in the body for less than 5 hours. Usually the peak time is about 2 hours after injection. And intermediate-acting insulin's effect is detected in about 2 hours, peak at about 11 hours and lasting 20 to 29 hours. Long-acting one, slowly throughout the day. So just need one time per day. So depending on patient's needs, doctors may prescribe a mixture of insulin types to use throughout the day. For example, get long-acting insulin in the morning and then rapid-acting insulin at mealtime. The dose of insulin is calculated based on glucose level and also their body weights. Insulin cannot be taken orally because the enzymes in the stomach interferes with insulin action. So insulin is injected using a fine needle and syringe or insulin pen. An insulin pump may also be an option. The pump is a small device you can wear on the outside of the body, and a tube connects to the reservoir of the insulin to a catheter that's inserted under the skin of the abdominal area. A tubeless pump is also available. These pumps can be programmed to dispense specific amount of insulin depending on meals or activity level and blood sugar level. Some people with type 2 diabetes can manage blood sugar level by making healthy food choices and being more physically active. Many people with a type 2 diabetes need diabetic medications as well. There are many types of medications targeting multiple processes of glucose metabolism. Some diabetes medications stimulate the pancreas to produce and release more insulin. Others inhibit the production and release of glucose from the store, like a liver or muscle, into bloodstream. Some medications block the action of a stomach enzyme or intestinal enzyme that metabolize carbohydrate to glucose. Some medications make tissues more sensitive to insulin by increasing number or sensitivity of the insulin receptor. I guess many of you have heard of a drug named metformin. Metformin is generally the first medication prescribed for type 2 diabetes. Metformin reduces the amount of blood glucose produced in the liver and released into the bloodstream, also improve the insulin sensitivity and decrease the intestinal absorption of glucose from food sources. So it has a multiple function. For severe case, surgical treatments are another option. In some people who have a type 1 diabetes, a pancreas transplant may be an option. With a successful pancreas transplant, insulin therapy would not be required anymore. But transplants are not always successful, and these surgeries can add a serious risk. And it requires a lifetime of immune suppressant to prevent organ rejection. And these drugs can have additional serious side effects, including a high risk of infection, organ injury, or certain types of cancer. Because the side effects can be more dangerous than the diabetes, and transplants are usually reserved for the people whose diabetes cannot be controlled or those who also need a kidney transplant. Another surgical option is a bariatric surgery. Although it's not specifically considered as a treatment for type 2 diabetes, and people with type 2 diabetes who also are obese. And according to the latest guideline by the American Diabetes Association, bariatric surgery is recommended for type 2 diabetes with the body mass index higher than 35. People who had these types of surgery have seen significant improvements in their blood sugar level. However, the procedure long-term risk and benefits for the type 2 diabetes still need more information. As you saw, there are many treatment options available. However, prevention is the best way to reduce the burden of diabetes. Simple lifestyle changes have been shown to be effective in preventing or delaying the onset of type 2 diabetes and its complications. An important part of managing diabetes is maintaining a healthy weight through a healthy diet and exercise plan. Many research studies with people with prediabetes have shown that weight loss by regular physical activity in people with overweight can lower risk of developing type 2 diabetes. Also, physical activity lowers blood sugar level, and then exercise also increases insulin sensitivity, which means the body needs less insulin to transport sugar into the cell. It's very important to make physical activity part of a daily routine, aiming for at least 30 minutes or more of aerobic exercise most days of the week. And healthy eating is also a critical component. There's no specific diabetes diet. American Diabetic Association, Diabetes Association, and then CDC recommendations recommend more fruit and vegetable and whole grain, food that are high in nutrition and high in fiber and low in fat and low in calorie, and cut down on animal product and refined carb or sweets. A registered dietitian can help you create a meal plan that fits your health goal and food preferences and lifestyle. This will likely include the carbohydrate content. And smoking and diabetes are strongly associated. So quit smoking will help prevent and manage diabetes. These preventive approaches sound straightforward, but often it's difficult to follow by yourself. So this link is the CDC-led National Diabetes Prevention Program site. And this program can help make a lifestyle change and stick to those changes. Through the program, people can lower risk of developing type 2 diabetes by as much as 58%, and then 71% among people over age 60. This program highlights working with a trained coach to make realistic, practical, and then lasting lifestyle changes, and also discovering how to eat healthy and add more physical activity into daily activity. Also, finding out how to manage stress and then stay motivated and solve problems that can slow the process. And getting support from people with similar goals and challenges. So it's a very useful program. Let's talk a little more on diabetes meal plan. A diabetes meal plan is a guide that tells when you can eat, what kinds and how much of food you can choose, and you can obtain a nutrient that you need while keeping blood sugar level in the target range. So good meal plan will consider individuals' goal, their eating habits, and as well as any medications they are taking. Some meal planning tools include the plate method, and carbohydrate counting and glycemic index. According to the American Diabetes Association, one of the simple and effective ways to manage blood sugar level is to use the plate method. The plate method is a visual way to make sure to get enough non-starch vegetables and lean proteins while limiting the amount of higher carb food. And it's recommended to include 25% of protein, and it could be beans and lentil, nuts and seed, fish, seafood or egg, some poultry, and 25% of grains and starchy food. Could be corn, rice, brown rice, potatoes, yam, or quinoa, and etc. And 50% of non-starch vegetable. Then you can add a serving of fruit or a serving of dairy or both as your meal plan allows. And then choose a low calorie drink like water or unsweetened tea or coffee. And this is the link to the Diabetes Food Hub offered by ADA, American Diabetes Association. It's an interactive tool to create your plate. Once you create an account, you can drag and drop food into your meal plan, and then you can even save those recipes. In meal plan, controlling portion size is really important to manage body weight and blood sugar level. Portion size and serving size are not always same. And portion size is the amount of food you choose to eat at one time, while a serving size is a specific amount of food, such as one slice of bread or 1 cup of milk. So this could be a visual aid for the portion size. For example, 3 ounces of meat or fish or poultry, which is similar to the palm of a hand. And then an ounce of meat, which is, or cheese block, about thumb size, tipped to the base. And then in 1 cup or 1 medium fruit, it's about fist size. And then 1 or 2 ounces of nuts or pretzel or other snack, that's about cupped hand. And then 1 tablespoon is a similar size to the thumb tip to the first joint. And then 1 teaspoon will be the fingertip size, so tip to the first joint part. So this could be useful, the visual aid to measuring portion size. Another tool is carbohydrate counting, also called carb counting, is another meal planning tool. It's for each individual with the diabetes are different. So on average, people with the diabetes should aim to get about half of their calories from carb. For example, for an individual consuming 1,800 calories per day, it's recommended to get 200 to 225 grams of carbohydrate at a day. By the way, 1 gram carb generates 4 calories. And so 800 to 900 calories can come from carbs. Some people may need more, others may need less carbs at meals, depending on how they manage their condition. I just listed the examples of carb counting equivalent to 15 grams of carbs. One more tool I'm going to talk about is glycemic index. It's a more complicated concept compared to the other two. Glycemic index measures how a carbohydrate containing food raises blood sugar level. A food with a glycemic index lower than 55, that's considered as a low glycemic index food. If it's between 56 to 69, that's a medium glycemic food. If it's higher than 70, that's considered a high glycemic index food. So food with a high glycemic index raises blood sugar level more than a food with a lower glycemic index. And International Glycemic Index database is maintained by Sydney University Glycemic Index Research Services in Sydney, Australia. And the database contains the result of studies conducted at research facilities around the world. Knowing about diabetes is very helpful for patients to manage their blood sugar level and blood pressure and cholesterol level. Diabetes self-management education and support services provide information on education and support resources. These resources help you make better decisions about your condition and help you work with your healthcare team to get the support you need and understand how to take care of yourself and learn the skill, including eat healthy, be active, and check blood sugar level, and take medicine properly, and cope with emotional or other stress factors due to the diabetic condition, and reduce the risk factors or other health problems. So this is just a screenshot. I took the service in that service program. When I typed in Blacksburg, I showed available diabetes education program around this area. So you can search for your area. In addition to education and support program, your healthcare team will help you learn how to take care of yourself and manage diabetes. Your healthcare team include diabetes educators such as physicians and nurses and dietitians and pharmacists and other healthcare providers who have a special training and experiences. Most insurance plans, including Medicare and Medicaid, cover education as well as treatment. Coverage such as hours of education, types of medication, and test kits, and etc. may be different from one insurance company to another. So you need to contact your insurance provider for detailed information. The Affordable Care Act allows people who do not qualify for Medicare and Medicaid and or do not have employer-sponsored healthcare insurance to get care for their diabetic condition. So in summary, diabetes is a serious metabolic disease characterized by high blood sugar level and also often with the insurance resistance. It is a growing healthcare problem with ramifications affecting individuals' health and healthcare system and the economy of the US and the world. The good news is it can be prevented and reversed by following treatment plan. And early detection is really critical to manage and prevent the progression of the condition. And careful management of diabetes can reduce your risk of serious, even life-threatening complications. No matter what types of diabetes you have to make a commitment to manage the condition and then try to choose healthy food and maintain a healthy weight and make physical activity part of the daily routine. Diabetes education and support programs are available, and diabetes care and education specialists makes manage diabetes easier. They work with each individual to develop own plans to stay healthy and give the tools and ongoing support to make that plan a regular part of life. And numerous functional foods have been shown to improve glucose control in some studies, while other studies failed to find any benefit. So in this year's Get the Fact webinar series, we will talk about some of those functional food components. Okay, that's all I have. Any questions? Thank you. Okay, if you don't have questions, I'm going to end this webinar. And again, thanks for joining. I will upload the captioned one in a few days. Thank you.